Captain Duke is asking, do I need to find a telemedicine provider in my state, or can I use a service from another state?
That is an excellent question. So you can traditionally only see a doctor in your state. However, depending on the state you are in at this time, states have relaxed the laws to say, we understand that we're in a crisis, and if you need to see a doctor from another state, we'll allow you to do that. It varies by state. Being in Texas, we received an email directly from the Texas Medical Board, which essentially said, if someone wants to practice in the state, we're going to expedite their licensing and help them. So they're not making it an exemption, but they're speeding up the process. But they also said something along the lines of, we understand you're trying to help. Normally, if I practice outside of state, I risk being in trouble with the board and potentially losing my license. So they're essentially saying, we're going to try to help you get licensed, but if something happens, we're not going to be punishing you. And it's a way of saying, do what you can without outright saying, break the law. And, I appreciate the Texas Medical Board. We have more physicians. We have the largest medical society in the world here in Houston, and other states tend to follow Texas when it comes to laws for medicine. So I hope other states will follow suit as well.
Yes. And I think that is forthcoming. I certainly have seen quite a bit of communication coming out of the state of Nevada's, it's called Department of Public Health, but it's the medical board, etc. Also working on similar guidelines. I know California has quite a few things that they've also made available. I think what you should know as a patient is that the doctors know specifics for their states.
Exactly.
So if you were to call and access a telemedicine service, trust me, they know what they can do and what they can't do, because they are also very mindful of the liability and the risk. So they're following the advisories. As you can see, Dr. Rowe, being the physician executive for Rowe Wellness, is aware of what's going on. The other thing is, a lot of doctors have a licensure in more than one state, correct?
Correct. We have doctors who have 15 medical licenses, and we are getting, within the last 24 hours, we've had about 100 doctors say, we want to get started. So we have a lot of doctors already with multiple licenses, but that network is growing as we speak. So even more doctors are available online to help you.
And can you also, Dr. Rowe, again, you're speaking specific to your organization, but a lot of other telemedicine organizations work this way. What specialties? Somebody may be looking and thinking, oh, this is just primary care, just a family medicine doctor or just a pediatrician. Not that that's a just, by the way, not just. But in addition, who else is there in your network?
So yes, traditionally, a lot of telemedicine companies are similar to urgent care online. You see a different doctor every time. It's just, a quick fix. Our company, Rowedocs, it really wants to connect you with a doctor that you can follow over time. And because of that, we have multiple specialties. We have pediatricians, we have cardiologists, heart doctors, we have nephrologists, kidney doctors, we have a lot of women health specialists we love. And so they can help you with different things like family planning, infertility care, like Dr. Duke. So we have surgeons who do post-op follow-up with their patients. So it's not just about coronavirus and sick times, but really having access to care over time and being able to have a relationship with a doctor that can follow you for that problem. It's great for second opinions. We as African American, Caribbean female physicians, our group makes up only 2% of physicians. So if you want to see someone that looks like and we know that, okay, we can help you to connect with someone you feel comfortable with without having to drive miles to have that relationship with the doctor.
Correct. And also, we're talking today primarily about coronavirus, but as I emphasized yesterday, the other part of all of this that we're talking about in the pandemic time is avoiding unnecessary visits to the hospital if it can be addressed before going. And so, yes, if you're someone with kidney disease, heart issues, etc., if it can be addressed, maybe your refills, etc., that prevents you from going somewhere where you as an at-risk patient are now exposed to coronavirus, telemedicine helps you with doing that, because you can get your refills through your teledoc, etc., if indeed that's something you need, because you don't want to miss your medications. We don't want you missing your meds. We don't want you not taking your asthma medications, etc., because then that makes it more difficult for you to be treated. It also puts you at risk if you have to go to get treated because you missed your medications. And so that's what we're talking about today.
To that point, I think some people may think, well, I'm not going to go to the ER or urgent care, but my doctor is telling people who aren't sick not to come in, so it'll be okay to go there. Just remember, we're still learning so much about this disease, and they really haven't confirmed if people are spreading the disease when they have symptoms, when they don't have symptoms. So you may be sitting next to someone who looks perfectly fine, and you could be contracting the disease at that time. So that's why I think, to just reiterate your point, it's so important. If you don't have to go to a doctor's office, please don't do it.
Yes, and absolutely, with this coronavirus, and actually all coronaviruses, people shed virus before they have symptoms. They're shedding, and that's all you need is viral particles to be shed, and you are going to spread it.